What is Hashimoto's thyroiditis? It is named after Japanese physician Hikaru Hashimoto, an autoimmune disorder in which body's own immune system attacks the thyroid gland, which is causing infiltration of lymphocytes and plasma cells between follicles, leading to atrophy of follicles and inflammation and underactivity of thyroid gland. As we can see, thyroid gland from frontal and back view, situated between larynx and trachea, having two lobes, right and left, connected by isthmus. Hypothalamus releases thyrotropin releasing hormone that stimulates anterior pituitary gland to release thyroid stimulating hormone. Thyroid stimulating hormone acts on thyroid gland to cause release of thyroid secretions T3 and T4, which perform their respective function. Negative feedback mechanism helps in the control of thyroid secretion. Rule of thumb can be used to determine approximate size of lobes of thyroid gland. It varies accordingly in every individual depending upon their age, size, and physical conditions. Dimensions of upper one-third of thumb corresponds to the length, width, and thickness of the lobes of thyroid gland. Patient may present in OPD with following symptoms: fatigue, increased sensitivity to cold, constipation, weight gain, pale, dry face, goiter, brittle nails. Increased sensitivity to cold is because of decreased metabolism. Constipation is because of impaired bowel movements. Weight gain is because of decreased digestion. Hashimoto's thyroiditis. In this slide, we can see the patient with fatigue. Patient with depression can be seen. Deficiency of T3 and T4 leads to excessive stimulation of TSH on thyroid gland, causing goiter, which can be seen here. A patient of hypothyroidism presents with sudden weight gain, primarily due to decreased metabolic rate, which leads to impaired digestion and fat accumulation, causing weight gain. This slide is a summary of the clinical presentations a patient of hypothyroidism may present with, ranging from fatigue, goiter, intolerance to heat, changes in mood, change in bowel movements, trembling hands. Since Hashimoto's thyroiditis is an autoimmune disorder, this means that it is likely caused by a mutation at the genetic level and runs in the generations, which is why family history is required. Multiple diseases are linked to Hashimoto's, including hypertension, type 2 diabetes mellitus, adrenal insufficiency. While taking history, patients often complain about anxiety, constant state of drowsiness, stress, overthinking, and lack of exercise. Type 2 diabetes mellitus is also associated with the sedentary lifestyle. During physical examination, patient should be palpated to check for the presence of goiter. He or she can be asked to swallow while placing hand in front of the trachea. pulse rate is reduced below 60 beats per minute, which reveals bradycardia. Skin appears to be dull. Periorbital swelling can be seen in eyes. Tongue is thick and dry. Respiratory rate is reduced below normal 12 to 16 breaths per minute, which is bradypnea. Reflexes are slow. For lab investigations, the patient's thyroid profile is carried out. It reveals decreased T3, T4 levels, elevated TSH levels, presence of anti-TPO antibodies and anti-thyroglobulin antibodies. In some cases, ultrasounds may be carried out to investigate the cause of enlargement of the thyroid gland. It will show whether the thyroid gland is diffuse, nodule, cystic or filled with fluid. This slide shows the thyroid profile of certain thyroid diseases. Normally, anterior pituitary secretes TSH, which turns on the cells of thyroid gland to secrete T4. Sufficient level of T4 give negative feedback to the anterior pituitary, which stops the secretion of TSH. In case of hyperthyroidism, negative feedback mechanism is impaired, which will lead to low TSH level and high T4 levels. In case of primary hypothyroidism, there is defect in the thyroid cells, leading to high TSH levels and low T4 levels. In case of secondary hypothyroidism, defect lies either in the anterior pituitary or hypothalamus, which will cause low TSH and low T4 levels. Hashimoto's thyroiditis is primary hypothyroidism. Primary course of action is to combat the inflammation. Therefore, anti-inflammatory drugs are administered, which include aspirin, paracetamol, etc. Secondarily, thyroid replacement therapy is given to normalize the levels of T3 and T4, including levothyroxine, altroxine, triiodothyronine. Patients are rechecked after 6 to 8 weeks. Their TSH and free T4 levels are rechecked. If these levels are lowered, then treatment is successful and continued. If raised, then dosage is increased. In this slide, we can see the comparison between the signs and symptoms of hypothyroidism and hyperthyroidism. In hyperthyroidism, because of increased basal metabolic rate, weight loss, heat intolerance, tachycardia, nervousness, insomnia, and sweating can be seen, which is completely opposite to the hypothyroidism. This slide sums up Hashimoto's thyroiditis. Thyroid gland is a small butterfly-shaped gland located in the front of the neck. It is not palpable unless goiter or extremely slim person. Goiter refers to the enlargement of thyroid gland. Thyroid gland releases hormones T3, T4 that regulate metabolism, growth and development.